Hello and welcome to the fourth edition of the Watchdog for 2023. My name is Vuyo Mvoko, and on the show tonight, the Department of Health has again flagged the high number of teenagers giving birth in public facilities. Deputy Minister of Health, Dr. Sibongiseni Dhlomo, is my guest. He'll be followed by a panel of experts as we discuss how we can put an end to this problem. And later on in the show, as we prepare for the start of the academic year, civil society has called for a back-to-school grant to ensure that no child is left behind. The Congress of South African Students, among others, weigh in. The Watchdog starts now. Now, according to Stats SA, between March 2021 and April 2022, over 90,000 girls aged between 10 and 19 years of age gave birth across all 9 provinces in South Africa. Between Christmas Day and New Year's Day, an additional 100 young girls gave birth across the country. The Department of Health has again flagged this as a concerning societal problem. To discuss this, we're joined by the Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Good evening, Doc. Thanks very much for your time. Now, while the Health Department has flagged the alarming number of how young women giving birth at public facilities, are there any targeted interventions that you have embarked upon?
Good evening, Vuyo, and good evening to your viewers, and Happy New Year to you. Yes, we are actually flagging this because there are programs that we are beginning to focus on. As a Deputy Minister of Health, I am tasked to be right around the country on programs that have to mitigate against this problem. Now, it's multifactorial, but let me pick up on the very first one that, among other things, points fingers to us as a Department of Health. On various platforms, the dialogues that we have had with young people are saying, but Dr. Dhlomo, I tried, I went to a facility and I was not really given a good attitude. I thought I was responsible enough as a 17-year-old to request support to complete my matric before I fall pregnant or make someone pregnant. And therefore, there was not a good attitude and assistance in facilities. Through those dialogues, we have then decided to embark on a program of a youth user-friendly reproductive health services countrywide. We have launched what we call youth zones. Currently, we have just over 2,000 health facilities in the country where we actually have trained a nurse to work with young people within that clinic or in a building adjacent to the clinic if the clinic is small. Through the dialogues, young people have said, but Dr. Dhlomo, we don't need nurses of your age because we are at our father's or mother's age. So can you really get us through these youth zones, young nurses? And through that, we have really learned quite a significant contribution and discussions with the younger nurses, with our young people, easy to approach, then accessing the reproductive health services. And we would want to see a decline. From the statistics you quoted, Vuyo, it is therefore saying at least we have 50 teenage mothers every day in South Africa. And that is what we're trying to mitigate. Because children, if they fall pregnant and give birth so early, chances of them reaching out to colleges and universities, TVETs, are actually reduced. And that is not what we need for economic development of the country.
I mean, as is the case with gender-based violence, for example, how much of a contributing factor are the socio-economic conditions of these young girls, where they have to, find people who can provide them, with something, and then they have no say in what those people, whether it's boyfriends their age or much older men.
That is a task bigger than us. It's a societal matter where me and you must socialize our boys to say, you can't come home and sit back and say to your sister, please dish out for me food, this and that. Because if you actually ignore that as a parent, that boy will probably do that to his wife in the next few years. So we need to be very firm, at least because this socialization must start in the families. But again, you are correct, Vuyo, because as I have said, it's multifactorial. If I am a man of my age, your age, and there is a need to support poor families and the poverty-stricken children to go to universities, why is it that we are not raising a moral campus, but say, I will provide you with this and that service to actually make sure you have food to eat, but in return, I need sexual favors. It's a moral campus that men in our country must actually look into. If, Vuyo, it is bad for anyone to sleep with my 16-year-old daughter, it must be equally bad for me to sleep with your 16-year-old daughter. So that societal matter is a matter that all of us as men must lead, because you are correct. It borders on gender-based violence, where we are actually treating girl child, young women as second-class citizens. We men will dictate and actually give. So it's an empowering program. I'm glad you are flagging some of those things. In 2016, in our country, we launched a campaign that said, she conquers. We were saying to young girls, let us empower you. Can you be a conqueror in the midst of all these problems? Can you say to yourself, there's no man who is going to give me support. In exchange for that, I must give my body to them. I want to finish my matric before I'm HIV positive, before I'm pregnant, before I get sexually transmitted infections. I will do everything humanly possible, but not at the abuse of my body. She Conquers was a very important campaign, awareness and supporting, empowering young girls to be on their feet and say, if men out there are not willing to support you, but you must be able to conquer this world in the fight for your own body, for your own health, and for your own integrity.
What have you thought about, or are you working with, the Department of Education, for example, to look at what schools, the role that schools can play?
Yes, we are actually working with as a Deputy Minister, I work very closely with the Deputy Minister of Basic Education. We actually launched last year a very important campaign focusing on how to prevent pregnancy amongst young, for adolescent girls and young women. But we need the whole societal support. We need school governing bodies. Vuyo, me and you sitting where we are, we want to believe that our 16-year-old daughters are not involved in sexual activities. Our 16-year-old boys have not started sexuality. Now we need to actually go beyond that and say, let us agree and allow our school nurse, help school nurse to come into schools and support with education and support with health promotion and preventative programs on the sexual and reproductive health. Let us allow that to go on. We work very closely also with the Department of Higher Education. There's a program called Higher Health, where they say in higher education, they need us and support from health to come in with educational programs on health. And we go there on campaigns like Graduate Alive. We go to the university and say, you came here HIV negative, please complete HIV negative. We have campaigns that says, first things first. What you came for here in this university, TVET, is a diploma, a degree. We are here to assist you. All other things can wait, including unprotected sex, including unwanted pregnancies, all those things. If you want to have, let's have you on these programs. So those are empowering programs that we do in collaboration with other departments, because we would have programs on health, but to access children, learners at school, be it at the university or at the basic level, we need to work in partnership with the other departments. Of course, social development is also our partner, but there are other NGOs in the country that are also very pioneering this work in their various platforms and work.
Now, in the cases of pregnancies being as a result of sexual assault, for example, is there a support system for these young mothers?
Very little. We probably don't get to access all of them. Of course, some of them do get that support we're talking about of a grant, but for them as a young 15, 13-year-old mother, chances of them getting back to school, they end up being dropouts and very unlikely to continue with their education. They don't go into programs that are self-empowering and giving them skills. So that's why we want to cap them, because if you would want to have pregnancy of a young woman and you start it at the age of 20, 21, chances of that woman is that she has already gone beyond the basic foundation of what is it about life. She's almost at the tertiary and already planning to be a professional or having a skill to navigate through another 50 years of life if she's given 50 more years of life to live. But if at the age of 13 you fall pregnant, chances of getting pregnant are again at the age of 17 and 21. By the time you are 22, you have already got 3 children, are extremely very high. And that mother, that teenage mother, is unlikely to really be able to be empowered and have resources to navigate through life for the rest of her life. And if she lives up to about 60 years, it's a very difficult life. So we would want to avoid that, because we don't think we are having enough programs that we have in place to support young mothers very effectively to navigate through life. Yes, here and there they are, but we don't want to get there. We would rather prevent 13-year-olds becoming mothers.
Lastly, I mean, perhaps speaking to you more as a doctor now, what are some of the dangers or problems associated with pregnancy at a very young age? I mean, we've had girls as young as 10, giving birth.
Yeah, you realize at around age 19, 20, women are really shaping themselves because of hormones. They are really shaping like a woman, getting the pelvis to enlarge, to shape in a different way, very much different than your pelvis and my pelvis, allowing that at childbirth, the baby's head can be able to push through easily through the birth canal. With a 10-year-old, chances of them delivering normally are very slim. They end up going to theater and start to be really getting to cesarean sections. I mean, anytime when you have an operation, it's just not a good thing. But again, they are too young, some of them, to be able to push through and sustain even the childbirth. So we really see a lot of, in fact, if you are impacting on teenage pregnancy, you are already improving your statistics in the country of maternal mortality. A lot of mothers who are 10 years, 17 years, and 15 years are struggling to give birth normally, and they do die because their bodies are not matured enough yet to allow that normal program of a birth canal. And There are many other things related to the infant coming out, not being cared for properly. The infant is not at the right maturity. So there is just no bonus for a 13-year-old to start getting babies. But she too is still a baby, and her body is not really matured enough to withstand, because really pregnancy is a normal process, but it's a very challenging physiological burden on a woman. It must find a body matured enough to be able to navigate through that 9 months of a physiological exercise of carrying a baby right through.
Dr. Dhlomo, let me thank you very much for your time this evening.
Thank you very much.
Deputy Minister of Health, Dr. Sibongiseni Dhlomo. In a second, we'll be speaking to researchers and non-governmental organizations about this problem. Now, researchers and non-governmental organizations say the rising number of teenagers giving birth in South African health facilities is a symptom of other societal cancers like sexual abuse, and highlights how the vulnerable in our society are often ignored and subjected to harm. To discuss this, I'm now joined by child protection consultant Joan van Niekerk and Save the Children's Gugu Tlaba. Good evening to both of you, and thank you very much for your time.
Thank you for having us.
One wonders, Joan, just what is perhaps the role that poverty plays in this high number of teenage pregnancy problem?
This is a very big problem, Vuyo. And it's all very well for us to talk about these programs for the girl child, encouraging girl children to remain at school. But the reality is that since COVID and since our, very high levels of unemployment, poverty is a very, very real issue. And yes, we come across girls who are not just supporting themselves, but supporting whole families through sexual exploitation. And so, we really need to look at the poverty and unemployment that is besetting our communities at the moment. There's another thing, a couple of things that came up from Dr. Dhlomo's input this evening that really, in the work that I do, stands out for me. I think, first of all, we have to see ourselves as role models for young people and for adolescents. And I want to challenge our politicians. At the moment, we have a highly immoral government. And I hesitate to say that, but I think it's known that the corruption is really, very serious. Trying to get young people to behave morally. The other thing that really bothers me is the fact that we've left boy children behind. We've had so many programs for girl children, and I think boy children really do feel they've been left behind in this process. And I think there's a special challenge in bringing up boy children to be good men. And my appeal is, let's look at the empowerment of children to deal with their sexuality responsibly. And let's make sure that every child that goes to school is properly nurtured and cared for without the pressure to somehow or other bring money into the home to feed themselves and their families. These are issues that really sit on my mind. The other issue that you brought up with Dr. Dhlomo that he did not address was sexual violence against children. We have a very, very poorly performing justice system at the moment. And very few cases of sexual exploitation or sexual abuse that are reported to the system actually end up in a conviction. I come across many children who've reported abuse, but years go by before their cases come to court. And that is the kind of situation that really lets offenders move on with impunity. And so we've got to address this as well when it comes to children. There are There are no simple solutions to what is a very complicated problem. And childhood and adolescent pregnancy is a very complicated problem. It's multifaceted in causality, and solutions need also to be multifaceted.
Gugu, I mean, sexual violence, poverty, what else, in your view, is contributing to this problem?
I think I want to start on the fact that the causes are multifactorial. And when I say that, we're looking at the fact that the child is within a family. Now, question is, what is the child being taught about their sexuality at the home? Because children really value what they learn from the people that are close to them. And so it means we do not have a strong education that helps them to understand their sexuality. Besides that, to value themselves and to be able to learn at that early age, even before 10, to develop goals that they can be excited about and be motivated either to stay in school and to continue to pursue them, no matter what their academic abilities are. And so it means we need to build a culture within the home. We need parents that are present. Right now, because of poverty and other issues, you find that parents are not present. They are either working 16 hours, or just the communication between a parent and a child is not strong enough to help the child to build a good moral system, as Joan has indicated. And then we've got a percentage close to 20% and more of children that are abused. And at times when they are abused, the parents either they don't know because the child is not talking to them, is talking to their friends, or the child reports and the parents conceal the abuse, because in many instances, children are abused by children that they know very well. Mm-hmm. And so it means even if our justice system is not doing so well, there are a lot of cases that are not reported. And so we have a problem around us. And the other thing is media. We've got a huge proliferation of media, all kinds of media, whether it's Facebook or, all other media that is influencing children, and no one is guiding them on how they should sift that particular information they're getting, such that in the end they end up wanting to do things that they wouldn't do if they were not so much exposed. And very important, the fact that we currently don't have good data on who is impregnating the girls. Because if it's older people, then we need to focus our messaging to the older community on what they are contributing to. And if it's boys, then we need more messaging to boys about the sexual intercourse that is not planned. But right now we're doing a lot for girls, and that is not, it's showing that it's not effective. So those are some of the things, but very important for society to note. It's about individuals, it's about families, and the society. If we do not approach this program together, we are not going to have good results. That's basically it for you. Thank you.
Joan, one wonders, because, often, and I remember the last 2 times I had an official of the Department of Social Development. They were waxing lyrical about the support that they are giving to teenagers, of course, often only after the effect. But in your view as an outsider looking in, is the system catering for these problems, whether it's a problem of, parents who are not present, or whether it is older people impregnating young girls? Is the system actually, alive to this reality?
I think that we as citizens of this country also need to see this as our responsibility. I don't believe government is doing enough, but I also don't believe that citizens of this country are doing enough to ensure that children are protected. It is clear from statistics that over half of the sexual assaults committed on children are committed by children, usually by boy children. So we've obviously missed the boat in terms of how we are raising our boy children as mothers and fathers. And I include mothers here because so few children in this country, a very small percentage, are growing up with both a mother and a father figure present in the family. And so mothers do have to take responsibility for how they raise their boy children. Do they raise their boy children with a sense of privilege? So many young people that we have spoken to across the network of resources in which I work, so many of the boys will say, you know, if I have a girlfriend, I'm entitled to sex. So many girls say, if I don't give my boyfriend sex, then he feels I don't love him. Some of the sexual offenders that I've worked with who are young people, they're very much influenced by exposure to pornography. So they see a lot of sexual behavior online or through their phones or shared at school, and they wish to emulate it. They find it sexually arousing. And yes, I agree with Gugu. We need to be talking to our young people as parents and caregivers and school teachers and clinic staff about responsible sexual behavior. So to my mind, government could do a lot more. I really do believe that we need to truly upvamp our justice system when it comes to cases involving children. I believe that we need to also be looking at our schooling system. I was delighted to hear Dr. Dhlomo talking about clinic staff being child-friendly, because this is a big complaint that we get from children also. They're too scared to go to the clinic for contraception, especially in rural areas, because the clinic sister knows my mom and she is going to talk to my mom. It's not as though I feel I could go confidentially to the clinic. So all of these things are things that we've got to bring together. Citizen responsibility, parent responsibility, educator responsibility, government responsibility across departments. We need to help our boys understand that there's no sexual entitlement that is due to them just simply because they are boys and have a relationship with a girl. That in actual fact they need to honor their own bodies and the bodies of the girls that they befriend. So these are all the things we need to be working on. One of the boats we are also missing is we don't talk to children enough about parenthood and what parenthood actually entails. In our life skills and sexuality education at school, particularly from about grade 6 or 7 onwards, we should be talking to children about the responsibilities attached to parenting. We were approached when I worked for Childline by a school in the Western Cape area that had a very high level of pregnancies. And we began a program there talking to children and having a week in which children had to take responsibility for something that represented a baby, both boys and girls. They had to budget, they had to nurture, they had to care, they had to, we asked parents to wake them up at night, which very few parents did, but yes, the idea was there. And it was interesting to see that with this sense of looking after a baby is a massive responsibility for which I am not yet ready, reduce the level of pregnancy in that school.
Gugu, I hear what both you and Joan say about taking responsibility, now parents taking responsibility, and I'm not for a second trying to bash the government or anything, but the point of having a government is so that, when there are spectacular failures like we are seeing, where parents are not present, as you were saying earlier, or they don't do what is supposed to be done, then it becomes the responsibility of government to ensure that parents do what they are supposed to do, and then, but also, of course, take care of the rest.
Okay. Thank you. Remember, government is formed by the very parents that we are talking about. So it would be counterproductive for us to say it all depends on government. Instead, we need to look at structures like school governing bodies. I'll use them as an example. We've got the life skills training that should happen in schools. Some schools are avoiding providing comprehensive sexuality education because the school governing body is saying you want to teach our children about sex, and yet this is an attempt to help children to understand their own bodies and how to restrict any sexual adventures. So it says we have a government in a school that is hindering progress to reduce teenage pregnancy. So we need to see it in that sense. Again, you take your faith-based organizations. What are they doing? We've got so many of them, and there are so many people and children. What is it that these organizations that are part of a governing structure, what are they doing to ensure that they teach the teenagers that are exposed to them in order for us to win as a government? And so if we use all these structures, I've just used these two as examples, but we've got many. The unions themselves, unions have so many men and women that have a responsibility to govern, and they govern in their own level, so they need to make a difference in that level. But if we were to check right now, we've got so many teachers that are impregnating girls, and they're part of a union. What is that union saying about that? You see, so we've got many structures that should see themselves as part of government and work with government to make a difference. And then government will provide resources, will provide the education platform, and then we will all be focusing on one goal. So right now, we have a responsibility as a country, and every individual must understand their leadership role, no matter what level they are at.
Joan, I mean, you would have heard Dr. Dhlomo talking about the dangers of very young children falling pregnant, and given the fact that, I mean, their bodies are simply not ready for it. How then do we ensure that, these both boys and girls are actually alive to this reality, that there are dangers associated with having to, bear a child for a girl as young as 10?
Indeed, and even a girl of 14 and 16, as Dr. Dhlomo was saying, these girls are not yet fully mature, and there are risks attached to bearing a child. Every child who falls pregnant under the age of 16, there is the possibility that this is as a result of some form of abusive behavior. And I believe that this is where our hospital systems are failing children. Every child who's under the age of 16 should be referred to a child protection organization for an investigation of how that pregnancy happened. When I say how that pregnancy happened, I'm not talking about the mechanics of the pregnancy. I'm talking about what was the relationship that this child was involved in. Was there coercion? Was there manipulation? Was there exploitation? And certainly for a child as young as 10, we are looking at some form of exploitation and abuse. In fact, any sex with a child under the age of 12 is considered to be rape in terms of our law. Not even, rape with sex with a minor. It's rape, pure and simple. So where are these children in our child protection system? They're not in our child protection system. I, at the moment, consult for a number of child protection organizations. We're not seeing these children. What this means is the Department of Health is not referring them. And so if they're not being referred, how can we protect them? So this is where health, I think, is failing children. No child under the age of 16 should be giving birth in a hospital and leaving that hospital without a firm referral to a child protection organization. Then we can investigate. Then we can see, what does this child need to be, need to happen? What service does this child and family need for us to be able to protect that child? It's the same even when children report abuse. We do have our Tutuzela centers, and they are great where they exist, because they don't exist everywhere when it comes to first reporting of a sexual offense. They're great in terms of the service they offer children and adults. But having reported, having received that initial service, that case can drag on for years. I've come across children whose cases have not been finalized, and I'm being absolutely serious here. After 10 years, it has been dragging on through the justice system. Eventually, these children and families give up, and they withdraw the cases. And when those cases are withdrawn, or when prosecutors withdraw them because the child is not able to testify, or there's not enough evidence, that child is going back into the community and perhaps even the family in which that child was abused without a child protection plan. I've spoken to our Deputy Minister of Justice about this many, many times. The other thing that's very concerning is that children who are having children are having unprotected sex. And we know that when it comes to HIV, sexually transmitted infections, we are in serious trouble with meeting our goals that have been shared with us as a result of the global funding for HIV and other sexually transmitted infections. We know we're falling far behind in those goals for children, not for adults, but for children. And I think that we need to kind of look at the HIV situation together with the pregnancy situation. You can give a girl a pill so that she will not fall pregnant, but that doesn't mean you're protecting her against HIV and other sexually transmitted infections. So our education needs to not be directed solely at pregnancy. It needs to be directed at the overall health of the child. Physically, mentally, socially, relationship-wise. We need to be looking at both children, if it is another child involved in a sexual relationship, the girl child who's going to bear the baby, and look at overall health issues.
You know, with everything that Joan has just raised, Gugu, one wonders or can't help but think about, you know, the effects mentally and emotionally, you know, all of these experiences have on these young mothers as they grow into adulthood.
Thanks, Vuyo. I actually was going to pick up on the mental health and psychosocial needs of the children. Yes, there is physical damage, but there's more mental health and psychosocial damage. And that is not easy to measure. So we end up ignoring it. Because if you're going to have a child take care of another child, already the problem is beginning. Because, as John said earlier, one, who is role modeling to this child? Because this child doesn't know what they're supposed to do. Who is actually making sure that this child gets the needs? Then it becomes the grandmother. Then, besides the fact that it's further contributing to poverty, it also contributes to an inability to grow emotionally. Then we have poor emotional intelligence in many other people. And we have people that are struggling to manage their stress level. And if you can check right now, our mental institutions are having more people that are bringing in complaints, including teenage mothers. So it means, as a society, as we ignore the problem of teenage pregnancy, we are contributing to the growth of other social problems, as you said when you started, poverty, inequality, unemployment, and even the murders and the sexual abuse that we're seeing that are growing. At times it's because of the toxicity that children are exposed to as they grow up. And then we bring up an angry community, and the violence that we're seeing is from the fact that children do not grow up the way they should. And so it means society needs to do something about it so that we turn around the situation. Because besides the physical illnesses, we've got more mental illnesses that are even difficult to cure because they don't even go away as easily as we would want them to.
Quick final one, Joan, if I may. Has research given us anything? In other words, do we know of jurisdictions that have had similar problems but have managed to deal with this problem? In other words, if there are any, what have they done that which we are not doing or haven't done yet?
It's difficult to say. I think in this country, we do need research. We need to be kind of looking at case studies. We need to be putting them together. We need to be looking at the factors that make our children particularly vulnerable to having children. And I agree with Gugu. Gugu's 100% right. I mean, it's like the poverty that may have catapulted the child into motherhood will go down the generations. It becomes very difficult to lift these children out of the kind of revolving cycle of poverty. So, yes, we need to research. We need to start looking at solutions. We need to have measurement tools in place to see how effective it is to have clinics that are child-friendly. The school pregnancy policy, I mean, that was a real opportunity, the school pregnancy policy. And it was discussed amongst groups of girls and groups of adults, but boys were not part of those discussions. So we need to be researching. Certainly, when I talk to colleagues internationally, we seem to have a greater problem than many other countries with which I interact. And I interact across the board, developing, rich, poor, and whatever. So we do seem to have a particularly serious problem here. Of course, COVID accelerated the problem. Immediately, our teenage pregnancies went up within the next year, and our termination of pregnancies in teenagers went up as well. So we should be very concerned about these figures and start researching the factors that lie behind the figures. And I agree with Gugu. I think we'll find that most of them are not medical or physical health related. We're looking at socio-economic, psychological problems and issues.
Let me thank both of you for your contributions to this discussion this evening, Joan van Niekerk and Gugu Xaba. Now, civil society groups have called on the South African government to introduce a special national back-to-school grant to assist parents with preparations for getting their children ready for the new school year. The PMB, Pietermaritzburg Economic Justice and Dignity Group, has led the call, saying that the government should allocate additional grants every January to help parents secure a sounder foundation to support education, while reducing debt incurred at the beginning of the year. Now, this proposal comes against the backdrop of the rising cost of living in South Africa. Joining us for this discussion is Publicity and Information Officer Douglas Ngobeni. Douglas, good evening. Thanks very much for your time. Perhaps before we speak about this proposal of a grant, I just want you to weigh in on this pregnancy challenge that we've been discussing with the Deputy Minister of Health and our two guests, Joan and Gugu. Just your thoughts on that one first.
Thank you, Vuyo. I'm a young South African who grew up watching you every morning on the television, and by so saying, I'm saying that I so wish that I joined you in studio physically just to share a moment with you, but I'm unable to do that as we are attending to issues of national importance when we conclude the National Conference of the African National Congress. But just to give a brief response to the issue of teenage pregnancy in South Africa, is in effect a way in which our parents have deserted their responsibilities as parents. Because we have made a call as the Congress of South African Students to say that once a learner goes out of their home, they go to the school, they now become children of the school. And once you find that a learner is pregnant, the teacher now has got a responsibility to go and report the case to the nearest police station. And if the person who has impregnated the girl is over the age of 16 and the girl is below, that person should be arrested for statutory rape. But it seems we have all neglected that position as a society. So it is in that regard that we find ourselves with ballooning teenage pregnancy. But it is a societal matter which I believe all of us need to sit on the round table and start taking proper discussions on it, because we have deserted serial humanitarian discussions. We are now ashamed to speak to our peers. We are now ashamed to speak to our brothers, sisters, to say that this is not how we should engage in sexual activities. And one thing which we have deserted is to speak to the boy child. We always put the blame on the girl child to say that you come home pregnant, but we have not taught our boy children to say that when you engage in sexual activities, you should wear a condom.
Now, what do you see as being your role as the Congress of South African Students in really, because we need all shoulders to the wheel on this one. How do you see your role in dealing with this challenge?
We have adopted a strategy and tactic to say that we should be the first example to incorporating our society in this view of saying that we should empower a boy child. So in the Congress of South African Students, first and foremost, we encourage anyone who is a learner, who is a boy child, to join the movement. We do not encourage people who are fathers, because they have already failed the prerequisite to see that when we speak about empowering boy children, you cannot come and become a leader of the Congress of South African Students when you have impregnated another child, likely to increase the issue of unemployment going forward, children who grow up fatherless and whatnot. So as the Congress of South African Students, we continue to engage all relevant stakeholders to say that let us go to communities, let us have these important meetings and bilaterals with these people in question. So we have programs such as Ubuntu. Ubuntu is a program which we have partnered with the NECT, National Education Collaboration Trust, which we speak to these learners, these young kids in South Africa, to say that this is the activities you should be engaging in at this age. These are not the activities you should be engaging in. And it seems that the program is working very well, because if you look at the statistics of teenage pregnancy in the last quarter, you find that they are dropping significantly, more especially in the areas where we have already touched.
Back to the question of the proposal for a back-to-school grant. Just your thoughts as an organization on this proposal?
We reject that proposal with the content it deserves. Because when you're a parent, you should be able to know that come January, your child needs to go to school. The government, if you depend on social grant to buy school shoes for your child, it now means that during December, you'd rather spend the money and not buy Savannah and wait for January to buy your child school shoes. We do not want to create a nation where we're dependent on everything. Social grants are enough. We have got more than 18 million beneficiaries of social grants. Parents should now start acting as parents. Parents should stop acting as if December comes 30 times in a year. December comes once, and they should not pass with that December. They should be considerate of the fact that their children need to go to school in January. Therefore, the only part and role we play as the Congress of South African Students is that we go to the deep rural areas where we find the vulnerable, the poor and the disadvantaged. We provide the little help which we are able to do at that particular point. So this one of the grants is something which should be rolled out as soon as possible. And the people who are proposing this, whatever whether it's a union or whatever it is, you find that these people are at a position of buying their children whatever to take them to school. So now they want to create an impression that the government of South Africa owes our parents everything. They owe our parents to take us to school in January and whatnot. So we reject vehemently that proposal.
Douglas, let me thank you so much, for your time this evening.
Thank you, Butwood.
He's, of course, the publicity officer of the Congress of South African Students, rejecting a proposal for a grant to be made available at the beginning of each school year. Many of you watching the program, of course, have an interest in it clearly. Let's go through some of the tweets that are on our timeline that people have been sending through as we were talking about this problem. We have Tekelo saying social ills are deeper, and we keep discussing the symptoms and not the root causes. Families are broken. Kids are raising kids. Rights are being preached with no responsibility. Nature doesn't allow for a vacuum. Mteto Williams says, I think the Department of Health should encourage and embark on an education for the use of long-term contraceptives by young girls to curb this teenage pregnancy in our country. Gwos Molife says, it's a very good topic to discuss. However, my personal take on all the social challenges faced as many in South Africa, we lack the ability to implement and to enforce our own programs. We had heard and discussed a number of interventions for years. Where are they now? Sia Bertram says, this problem can only be tackled if government schools are given proper facilities and giving kids more school activities and allowing children access to proper fields, proper sports opportunities, music facilities, art, and then we can talk about sex. Bradley Moody says, take the children's rights away when it comes to a parent disciplining their child, then you will see a difference. The law can't let parents get criminal records for disciplining a child. Currently, it's assault or sexual assault if you as a parent discipline a child. Okay, only some, of course, of the tweets that many people who are watching the program have sent. A very touching subject, a problem that we all really need to tackle as a nation. That brings us to the end of tonight's show. Thank you for watching, but do join us again tomorrow evening, same time.